Diabetes is not treated by just having one practitioner.
So I have a comprehensive healthcare team, and they're constantly checking in on me, making sure I'm as healthy as possible. I typically see my endocrinologist about every 3 months, and the reason why I do that is because I want to make sure that I'm having my blood tested, a fasting blood test, so they can check my HbA1c, which is super important. I see an eye doctor once a year to get a dilated retina exam. I typically will see a podiatrist once every couple of years, although I know I should probably see the podiatrist once a year. And then another thing that I think is really important that a lot of my friends and people who I know who are diabetic don't think much about is our hearing. Because as diabetics, we're actually twice as likely to have hearing loss than our non-diabetic peers. So I make sure I get my hearing tested once a year as well.
So I see all my specialists once a year, and I try to cluster my visits around my birthday. It makes it an easy way to remember.
Over the last 10 or so years, I've really learned that having a good endocrinologist that is a partner and not just a doctor is incredibly important, because I'm not looking for somebody who wants to see me once or twice a year, share my blood sugars, and that's it. I'm looking for somebody who is willing to talk with me in between. I've been very fortunate that both of my endocrinologists in recent years are type 1 diabetics themselves. And I think that that really makes a big difference in how that they care for their patients and their empathy and understanding of what it's like to live with diabetes.
So I find the most important thing working with my doctors is really communicating what's important to me. Because if they don't know, then it's hard for them to help me. And I think it makes the whole visit better.